Hi, everybody. Just wanted to reintroduce myself. I am Vanessa, and thanks for joining me. Today, we're going to talk about the viral disease of chikungunya. A little bit of overview of what we're going to be talking about today and some of the basics of the disease. We're going to talk about what it is, how it's transmitted, who it affects, and then most importantly, how we can work towards preventing the spread of it. All right, what is chikungunya? It's also referred to as CHIKV. It was first identified in 1952 in Tanzania and other surrounding African and Southeast Asian countries. Transmission is spread through mosquito bites, and it is not transmitted from person to person. The most prevalent symptoms include fever and severe joint pain, both of which can be debilitating, which gives it its name, chikungunya, which derives from the Swahili phrase of that which bends up, referring to the posture of somebody who is kind of debilitated with these symptoms. Other symptoms include chills, headache, nausea, vomiting, rash associated with the itching of the bites, all which are similar symptoms to that of dengue and Zika. So the likeness of that of CHIKV can actually easily misdiagnose CHIKV, and that produces incorrect treatment and prolonged suffering. So who gets CHIKV? CHIKV does not discriminate against age, gender, race. Everybody is just as likely to contract CHIKV as the next person. That being said, pre-existing morbidities or circumstances may make certain people more susceptible to experience a more severe case of the disease. So people at risk include newborns infected at their time of birth, older adults 65 and up, and people with medical conditions like high blood pressure, diabetes, and heart disease. So again, while transmission does not occur from person to person, there have been rare cases of in utero and intrapartum transmission. The virus has not been found in breast milk, nor has there been any reports of breast milk leading to infection. All right, where can we find CHIKV? So CHIKV has historically been prevalent in tropical and subtropical regions of sub-Saharan Africa and Southeast Asia. But as of 2013, transmission had been documented in the Americas. The CDC image found below indicates the countries and the territories in which CHIKV has been reported since October 30th of 2020. So the CHIKV vector, the mosquito, is typically able to thrive in like wet and hot environments, making a majority of the world a hospitable place for the mosquito, thus making a majority of the world a prevalent place for chikungunya to fester. So in theory, CHIKV could be carried by infected visitors traveling from these prevalent areas in the world. Therefore, if symptoms are occurring, testing should occur despite the region that the patient is from. All right. When can we see these symptoms? Onset of symptoms typically happen between 4 to 8 days after being bitten by an infected mosquito. The range is 2 to 12 days, and avoiding to seek medical attention or treatment may result in prolonged pain, lasting weeks, months, and potentially even years. So misdiagnosis, as mentioned earlier, can also result into a longer pain. So with the correct regimen, recovery could be as little as a few days. Despite the painful experience of chikungunya symptoms, the mortality rate is surprisingly low. The rare fatalities seen as a result of the disease are usually related to coexisting health problems, as we talked about earlier. The prevalence of CHIKV continues to grow, though, throughout the world. While there's no specific antiviral management or vaccines for CHIKV, the treatment of rest, fluids, acetaminophen typically remedies the patient's symptoms. So the sooner CHIKV is identified, the sooner we can relieve patients of their discomfort. All right, how can we prevent CHIKV? Simply put, what it all boils down to is preventing mosquito bites. Outside the clinic, we should advise our patients to make small but effective changes, like using insect repellent, wearing long sleeve shirts, pants, incorporating mosquito nets into their most frequented areas. And then we can control the presence of mosquitoes inside our clinic by ensuring our windows have screens, utilizing air conditioning when available, and maintaining a dry and clean environment, unhospitable for mosquitoes. All right, thank you again for joining me to talk about CHIKV. We discussed some of the fundamental details of the disease, like how it is, how it's transmitted, what it is, who it impacts. And with what we've learned today, let's move forward and protect our patients by preventing the spread of chikungunya. Thanks.